So today's topic is about understanding the hypertension. So in this topic, we are going to see what is high blood pressure and how to we are going to prevent it. So coming to the topic, so first we need to know what is blood pressure. So what is blood pressure? So there is a definition of blood pressure. What is that? So when what is this the heart is doing in the blood pressure thing? Basically, each time when the heart beats, it pulls the blood into the blood vessels. This causes a pressure in the blood vessels. This is measured as blood pressure. So once this is called as basically a blood pressure. Normally, the blood pressure will vary from time to time in a day itself. So normal blood pressure is 120 bar 80 millimeters of mercury. So when this blood pressure is keep on rising and rises for a and kept raised for a longer time, it is termed as hypertension. This causes a serious damage to the cardiovascular system, cerebrovascular system, renal system. So these three systems are majorly affected because of this hypertension. So this won't develop in a single day. Hypertension will always develop over a period of time. This hypertension is nothing but increase in blood pressure over a period of time is termed as hypertension. So increase in blood pressure is called as hypertension. This is about the definition of hypertension. So coming to the risk factors. So there are always several risk factors for the developing hypertension. So there are separated as modifiable and non-modifiable risk factors. Coming to modifiable risk factors, we are going to majorly see about age. So age risk factors plays a major role in the development of hypertension. As the age patient gets older and older, arteries of the patient will get stiffer and narrower because of fat deposition. When the blood flows through the stiffer and narrower pathways, the pressure will keep on increasing. This is a major risk factor in developing hypertension in the aged groups. So this is major non-modifiable risk factor. Coming to modifiable risk factors, another thing is excess salt intake. Excess salt intake is one of the major risk factor in the developing and developed countries, those patients having hypertension. So how is this happening? So what are the excess salt intake? Excess salt intake or excess sodium intake. So because of this excess sodium, how we are going to take excess sodium means by taking consumption of more amount of salt. So what are the things we are going to eating will make us the development of hypertension. When you take less amount of potassium containing foods, it also indirectly affects the development of hypertension. And eating lot of processed and fatty foods will also cause developing in hypertension. Then lack of physical activity and obesity is a major risk factor in developing hypertension. So coming to the next non-modifiable risk factor is stress. So you should avoid stress. We are in this generation, we are not able to handle the stress and we are going in different wrong pathways in managing stress, which may lead to the development of hypertension. The final non-modifiable risk factor is family history. The close contacts of the family members, one or two members who have developed hypertension, then the individual is also major risk for developing hypertension in the family group. So major non-modifiable risk factors are age and family history. Whereas modifiable risk factors are lack of physical activity, obesity, eating excess salt intake or sodium intake, avoiding stress, and stress is the major risk factor. Then consumption of excess alcohol and smoking. These are the major modifiable risk factors in developing hypertension. In coming to the symptoms of the hypertension, the one thing, the hypertension, the major symptom is there will not be any symptoms. So this is one of the danger sign. The hypertension is also termed as silent killer. So most of the patients will not have any symptoms or signs in their hypertension initial stages. Once the hypertension keep on increasing and it causes organ damage only, you will be developing major symptoms. So some of the common symptoms patient will be witnessing during because of hypertension will be mainly because of morning headache will be there, blurring of vision will be there, chest tightness will be there, sometimes breathlessness or palpitation can be present. So these are some of the symptoms of hypertension. So most of the time hypertension will not produce any symptom or sign. So how to diagnose? Only diagnosing method is to measure blood pressure. It's the easiest way to diagnose. Hypertension is just you can measure the blood pressure and you can diagnose a hypertension. So how to diagnose? What is the machine we are going to use in the measuring the hypertension is the machine is termed as blood pressure machine is termed as sphygmomanometer. So how is it measured? What is normal blood pressure? As I told before, normal blood pressure is 120 bar 80 millimeters of mercury. There are two numbers. Above 120 is nothing but systolic blood pressure. The below I told 80 is diastolic blood pressure. So what is systolic? What is diastolic blood pressure? So we are going to see in detail. Systolic blood pressure is nothing but once the heart contracts and pulls the blood into the blood vessels, that pressure is termed as systolic blood pressure. That once the heart contracts, the blood is pumped into the blood vessels. That is called as systolic blood pressure. Once the heart rests during the contraction period, the blood flows through the blood vessels. That heart relaxing period blood pressure is termed as diastolic blood pressure. So two variants are there, systolic blood pressure and diastolic blood pressure. So what is hypertension? Hypertension is nothing but, as I told before, increase in this both systolic and or diastolic blood pressure. Either both can be elevated or any one of them is elevated is also termed as hypertension. So when we can term as hypertension, patient can be termed as hypertension is nothing but when the blood pressure is more than 140 bar 90 millimeters of mercury, more than or equal to 140 bar 90 millimeters of mercury in two different occasions is termed as patient is termed as hypertensive. So normal blood pressure is 120 bar 80 millimeters of mercury. So when the patient is termed as hypertensive is nothing but more than 140 bar 90 millimeters of mercury. Systolic more than 140, diastolic blood pressure more than 90 millimeters of mercury. The patient is termed as hypertensive. So this is about measuring the blood pressure. So measurement machine is called as sphygmomanometer. Two variants, systolic blood pressure and diastolic blood pressure. So coming to the prevention part. So as we discussed before, what are the risk factors, symptoms, and how we are going to diagnose. Then coming to the management part, how we are going to prevent the blood pressure. Before, there are two ways of prevention. One is primary prevention, then is secondary prevention. Primary prevention is nothing but preventing the blood pressure before coming itself. Then secondary blood pressure is preventing the complications. So first we are going to see about the primary prevention. In the primary prevention, there are several ways. So what are the basic ways? Nothing but we are going to avoid the risk factors. So what are the things we are going to see is, first one is, so most important thing is regular exercise, healthy and dietary modifications, then quit smoking, reduce the amount of alcohol, salt monitoring of, reduce the amount of salt you are going to take, self monitoring of BP and stress management. So these are the major subtopics we are going to see in the prevention of the hypertension. So first we are going to see about a regular exercise. So what is regular exercise? Regular exercise is nothing but each individual has to be at least do a 30 minutes of aerobic exercise daily, or at least weekly 5 days of 30 minutes of aerobic exercise is definitely indicated in all patients who are to prevent hypertension. So regular exercise can prevent the individual before developing the hypertension itself. So aerobic exercise is definitely indicated. It can also help in the drug-free approach. Regular exercise and these prevention techniques will prevent the individual in developing hypertension, and it can also have a drug-free approach for the management of hypertension. Then it also makes the body weight. Regular exercise can reduce the workload to the heart, and the compliance of blood vessels will be good, and it also maintains the good body weight management is also regulated by the regular exercise. Coming to next one, healthy diet. So coming to the topic, we are going to next topic is healthy diet. Healthy diet. So as we discussed in the risk factors, major risk factor is increase in sodium content and low potassium intake is also a major risk factor for developing hypertension. So what are the healthy diet we are going to see is, there are 4 things. First one is DASH diet. DASH is nothing but dietary approach to stop hypertension. That is called as DASH diet. Next is less saturated fat. Reduce the amount of saturated fat you are going to take. Then increase the potassium level, increase the potassium containing foods levels. Then decrease the sodium, that is decrease the salt containing food levels. So come in this one by one we are going to see what is DASH diet. DASH diet is nothing but dietary approach to stop hypertension. So what are the diets we are going to recommend for stop hypertension is eat whole wheat grains, eat fresh vegetables, fresh fruits, nuts, and greeny vegetables, green leafy vegetables are majorly recommended in the dietary approach to stop hypertension. Then less saturated fat and whole fat should be reduced. The amount of fat less saturated fat should be reduced. Potassium rich should be avoided. Potassium rich should be taken in the patient. So what are the potassium rich foods? Tender coconut, milk, egg, the potassium rich foods. Potassium rich foods, so you should recommend for stop hypertension. Then reduce the salt content. Reduce the salt content by each tablespoon of salt contains 2300 milligram of sodium. So how much amount of salt you are going to reduce? You can reduce the sodium level. This reduction in the sodium will control the hypertension. This healthy diet method will control the blood pressure around 5 to 6 millimeters of mercury. So next, coming to the how to salt content is, there are three major things. First, you should see the food label. Food label, each food has its label. What are the contents will be mentioned in the food label. So you should pick up the less sodium content food, then avoid the processed foods. Always processed foods has more sodium levels, so you should avoid processed foods. Then reduce the amount of salt you are taking in the food. These are the major things in the healthy and dietary lifestyle modifications. Coming to the third prevention technique, smoking and alcohol reduction. So always quit smoking. Smoking should be definitely stopped, and alcohol amount consumption should also be very much reduced in the prevention of hypertension. Next, coming to the self-monitoring of BP. As I discussed before, BP variation will be within a day itself, there will be more variation will be there. So once in a while, you should keep on monitoring the BP in your home itself, so that you can monitor the BP when the BP rises, when the BP lowers, you can note down the BP and you can consult with the doctor when to give the antihypertensive tablet or when to stop the tablets can be monitored by using self-monitoring itself. So once in a while, you can self-monitor the BP in the home visits itself, so that it can be easily for the management of hypertension. Then finally, stress management. How to manage the stress? So stress management is a major thing. So you should keep on avoid the wrong pathways for the stress. So to handle the stress, and you should have a stress management techniques like exercise, yoga can be done, meditation can be done, listening to music, and focusing on simple things like that makes you calm. So these are the major stress management techniques. Whichever things works for you, you can do it in a right way, not in a harmful way. Stress management is a very major thing in the management prevention of hypertension. So these are the major primary prevention, and this primary prevention is also indicated in the secondary prevention of the hypertension also. Once the hypertension develops, so these things also helps in reduction in BP and maintaining the BP within a normal range. These things are very important. Then coming to the adherence of treatment. Adherence to treatment is nothing but once the doctor prescribes a tablet, you should keep on following the tablets, and the complaint should be good to the tablet, so that only BP will be maintained in a normal range and prevents the complications. So these are the major things in the prevention of hypertension. So we have discussed about the basic concepts of hypertension. So what is the definition of hypertension we have discussed, risk factors, symptoms and signs, how we are diagnosing hypertension, and what are the prevention and managing technique in the delaying the hypertension or preventing the complications. So coming to the conclusion part, nothing is more precious than a healthy and fit life. So for this healthy and fit life, you should keep on having a healthy and lifestyle modification is definitely indicated, like avoiding the salt content, have a good regular exercise, sedentary lifestyle should be avoided, quit smoking and alcohol. So healthy and fit lifestyle is more important in have a good, precious, healthy life. So this prevents a hypertension. This hypertension prevention is also an indication for preventing other cardiovascular mortality and morbidity. So thank you.